Hi guys, it's Dr. Chinhara again, bringing you a segment of Truth Be Told. Today, I'm going to talk about the various types of braces that we can use to straighten your teeth. We always get these questions from patients like, do I really have to wear braces in order to align teeth? And the reason people ask such questions is that the idea of a metal mouth sometimes is not quite appealing to some patients, and they ask, is there an alternative? So today, maybe let me just give you a bit of understanding about how braces work. So braces are little attachments that we place on each tooth, and they have a slot in them, and that slot is specially milled. It is a certain depth and it is a certain angulation, and which is very specific for each tooth. And in that slot we place a wire, and the interaction of the wire and the brackets generates a special type of force for each tooth to push it in a particular direction and to create the proper alignment that we want to see at the end. So the ideal is metal braces, because the engineering or the design and fabrication is much easier. The level of precision becomes much higher when you're using metal. So when people say, can I have an alternative? Well, alternatives are exactly that. Sometimes they don't quite deliver exactly the type of precision that we can get from a metal bracket. While they can still give good results, sometimes it might take a little bit longer and a lot of tinkering with these brackets. I mean, wouldn't it be a conspiracy if we could do it with other types of brackets? I mean, we'd have done away with metal, isn't it? So metal really is the standard. It's a much easier system to use, and also in terms of the engineering and manufacturing, the precision can be achieved much higher. But yes, we can give you alternatives. And what are the alternatives? Number one is you can have a bracket that is not metal, so it's not conspicuous gray shiny metal in your mouth. And these are ceramic type of brackets. And we can also use this with a wire that's coated on the outside and make it look like tooth color. So these brackets are not as conspicuous, but they tend to have a higher profile because the fabrication of a bracket using that type of material will be much more difficult because metal is much easier and it's more pliable. So they tend to have a bigger profile. So while you might not see it, it's not as observable. The downside is that you will feel it because it's a bit bulk against the lips. So that's the one alternative. The other alternative is you can still have metal brackets that give us good precision, but they're placed on the inside or the side towards the tongue. So they're not on the outside, so people won't see them that obviously. The downside is that your tongue is going to feel them all the time. So when we speak, sounds are articulated in an interplay between our tongue and the palate and the teeth. So when you're speaking, you're going to feel it. Sometimes it might create a lisp, and also it could lacerate the appliances could lacerate the tongue. But over time, one gets used to it because the tongue and the other tissues do colors. But that would be the downside. It tends to be a very costly exercise because it's a very time-consuming process for the orthodontist. You're working really upside down and on the inside, and the anatomy of the teeth on the inside is not as smooth curve as you would get from the outside. So it makes it more complicated in terms of mechanics. Then the third alternative is where we just use something that looks like a gum guard. It's like a glove on the teeth. It's a special type of plastic matrix which can generate force and begin to push the teeth in the direction that you want. It's a little bit complicated than the use of wires and metal brackets, but it is come of age now. At the beginning, it would be useful. We used to use it for much simpler cases, but now we can use it for real complex cases and still achieve as good results as with metal brackets. It tends to take a little bit longer, and compliance sometimes can be an issue because we have to depend on you wearing this plastic matrix on. If you don't wear it, it doesn't work. Whereas the metal brackets, once I fit them on, they're fixed. You can't take them off. So we know they're working 24/7. So those are the various different options that you can have when you have braces. So it's not just one way. We can arrive at a choice that is comfortable for the patient. Thank you. See you again for the next segment.